Every act of service has a story. Every story has the power to inspire. In a world that is always rushing forward, we pause to listen, to learn, and to lead with purpose. Here, conversations go beyond words. They ignite compassion, leadership, and change. This is True Rotarian, where service meets storytelling. I am Hemant Vasin. Thank you for being part of this journey. Let's begin. Hello and welcome to True Rotarian Podcast, a platform where we celebrate stories of leadership and giving back to the society. Ladies and gentlemen, today's guest is someone who's very special, whose life story reminds us that gratitude can turn into purpose and purpose can transform into impact. Born in rural India with severe visual impairment, he regained his sight at the age of 2 through a life-changing surgery. At that moment, became the foundation for a lifelong mission. From graduating as a doctor in pharmacy in the United States to founding a healthcare enterprise that grew to over 300 million US dollars, to selling it and devoting his entire time to philanthropy and mentorship. His journey is absolutely extraordinary. He is an entrepreneur, a strategist, a philanthropist, and a champion of childhood blindness prevention. It is indeed my honor and pleasure to welcome Sam Maddula.
Thank you for having me.
Welcome to True Rotarian Podcast.
Thank you.
And ladies and gentlemen, we are here in London. Both of us have come to for an event in House of Lords for World Childhood Blindness Day.
Correct.
This is what we are here for, and thank you so much for taking your time out and coming to my podcast.
You asked and I'm here.
Lovely. Sam, let's begin at the beginning of your life. You often describe your early years in India as challenging. What do you remember about that childhood, and how did your journey restored to vision shape your purpose? How did the single medical intervention, that gift of sight, influence the way you see healthcare and service today?
You know, I think it's a loaded question. When I was first born, I was obviously legally blind. I don't have any memory of it, but I am sure internally, intrinsically, there was probably a lot of trauma from being born like that, being in a village, being poked and prodded by doctors, having to come to the United States and then having surgery. Having my own 2 daughters now who are 4 and 1.
Oh wow, that's lovely age.
Thank you. So I understand the impact of small and large things that children can inherently take without being able to speak. So I'm sure there was a lot of trauma and some things that the child, the baby of me, couldn't really understand at that time.
And when did you realize that healthcare would be not just be a profession, but it will be a calling?
So my family immigrated to the United States prior to me. Most of my family, aunt and uncles, because they were pharmacists. And I grew up with my parents basically in a pharmacy. My parents were not pharmacists. They were blue-collar workers in the US because they had to make a living. And in that, I saw that medicine as a whole was a great way to cure people's ills, whether it was surgery to give me vision or physical medication to cure someone of a disease. So it was something that I benefited from, and I also saw others benefit from. So I knew that that was something that was near and dear to my heart.
Wow. That means the dedication and the technology was something that helped you with this mission, right? Dedication of doctors, dedication of pharmacists, and all those professionals who are involved in giving good health to everybody.
Hmm.
Wow, that's so wonderful. Now you were in United States and you went to Rutgers University and you became a doctor in pharmacy. What was the transition like?
Being a pharmacy school itself was hard. I would say socially, emotionally, mentally, until I became a pharmacist, and probably throughout, was not easy. And that was because I had a lot of self doubt. I definitely dealt with a lot of social insecurity, a lot of feeling different and less than. I believe that once I became a pharmacist and through a series of events was able to open my own business, the business became an extension of who I am. And that actually put into physical motion, I would say, my inner desire to do more.
Wow. Were there any moments of struggle or moments of clarity that defined your journey?
As a business owner,
Yes.
of course, business from the outside always sounds very easy.
Mhm.
It's extremely hard. I founded this company in a very inner city part of Philadelphia that was extremely challenging. So, coming from living in suburban New Jersey to being in an inner city, impoverished area was a struggle to understand, struggle to see what needed to get done because we created a company for mental health and substance use disorder in probably one of the highest crime neighborhoods in Philadelphia. And it took a lot to understand and to figure out what the folks needed. And then you asked, was there a pivotal moment? And I think once we were able to get folks to understand our mission and to get them the medications they need, and knew that it was working, and physicians were working with us, and other hospitals were working with us, and we saw that we were actually making a difference. We were saving people from, ending up in jails and ending up in hospital systems, and physically saving their life in a very small way. That was pretty enlightening.
So must have been life-changing experience for all those people because you offered them a service which was probably not there at that time or not promoted or maybe they could understand this is available.
100%. The medications that our patients needed cost anywhere from $2,000 to $20,000.
Wow.
So if you were a physician and you wanted to give that medication to your patient, to get that approved through the healthcare system is extremely hard. So what we did on behalf of physicians and hospital systems was all the back end work to get this drug approved for the most vulnerable parts of society that could not speak up for
Well,
themselves.
that's so wonderful. Now, most entrepreneurs, they chase trends. You chose one of the hardest spaces in healthcare, mental care, and substance use disorder. What gap did you see that others did not see?
Well, let's take a step back. When I graduated, the world was going through a huge recession. I graduated in 2009 from pharmacy school. And frankly, I was desperate for a job because I don't come from a well-off family. I needed to pay my loans and all that. And through a series of events, I opened a company with my uncle and another family member. I think when I look at something, because I grew up in medicine, medicine was kind of the conversation of everyday conversation, the kitchen table conversation. So I can look at something in a business and see what's missing. And again, what I saw that was missing was the need that people had and the want that the physician wanted to do, but nowhere in between was there somebody like a pharmacist to bridge that. So you as a doctor would want to give the medication to the patient.
And the patient wants to get.
And the patients want to get it.
Okay.
They don't want to end up in jail.
Yes.
They don't want to end up in a hospital system. But there was nobody in the middle.
Oh, okay. How did Bank's Apothecary begin, and what were the early years like?
It began in the back of a pharmacy. So think of a retail pharmacy that people walk into. In the back of that retail pharmacy, we had a little bit of space, probably 100 meters, something like that, 100 square meters. And we just built a desk and we just started doing it. And the beginning years were challenging because we were in a very high crime neighborhood. To get good help was hard. To be profitable was hard. So yeah.
Now, scaling a healthcare enterprise is incredibly difficult. What were the turning points that allowed the company to grow into a national platform serving more than 150,000 patients?
Yeah. So we served 150,000 patients a year.
Wow.
The way you said, what were the points? So initially, as I mentioned, when we saw the product that we were delivering to physicians and getting these drugs to patients that they needed, and seeing that happen, and more physicians calling us, and more doctors calling us, and more hospitals calling us, and it was like we went from 1 patient to 10 patients to 1,000 almost within a month.
Wow.
So we saw that need was there, and now all we had to do was just bridge the gap and get the right people and the right system in place to keep up with it.
That's so wonderful.
Yeah.
That's so wonderful. What were the hardest lessons in leadership, culture, and operational differences?
I don't know if they were hard, but the lessons that I took back was that it was extremely important for me to have people that not only worked hard, but that truly cared. Because you can have intelligent people, you can have people that came into work on time, but what you really need, the secret sauce, is people that will truly care as much as you do for the company that you're trying to build.
Absolutely. Now, looking back, if you had to do it all over again, what would be so different in today's environment, because things have changed, the AI has come in, method of working is different. How would you do it in today's circumstances?
Honestly,
Yeah.
I wouldn't do it any different.
Oh, okay.
I'm proud of the way we built it. I am proud of the patients we served, and maybe I would do it again.
Wow. Now, in 2022, you sold Bank's Apothecary. Most people would have retired at that point, but you learned lead into philanthropy and mentorship and strategy. What was the reason?
My wife wanted to kick me out of the house. I sold my company when I was 37 years old.
Okay.
So it wasn't like I was be out to the pasture. It wasn't like I was going to play golf all day. I had to do something. And I'll be honest, post-sale was actually extremely difficult, because you go from, running $1/3 billion organization to giving away the keys, and you just wake up the next morning and you're kind of done. So I needed to find a purpose.
Okay.
The first couple of months were actually pretty depressing, because what do? Yes, you have a little bit of money and whatnot, but you have to wake up with a purpose. So I chose to create a company called Workshop Strategy. And the essence of that company is something that I wish I had creating my own company.
Okay.
Which is, who do I learn from? What do I do next? Because there are so many people who are trying to build and do more, but they don't know how to get to the next level, or they don't know how to take the next step. Because we are no longer under our parents, we are no longer in college. There is no rubric, there is no instruction manual. So I wanted to create a company that I probably would want it to be used myself.
So you felt the need of this kind of a company, or this kind of a mentorship for growth, which is envisaged, planned, and required.
Correct.
Wow. Now, does success feel different today than it felt 10 years ago with starting off your company?
hmm I think the honest answer to that is I like, for me, success was always building. I was born poor. I was raised lower middle class. The money, whether folks believe it or not, doesn't really matter to me. It's this nice side effect. So success for me was never monetary. Frankly, at the end of my life, I'll probably help my kids out a little bit and just donate the rest. So the answer is, does success feel different? Success actually feels, for me, slightly different. When I was younger and building banks, it was all about building, just helping more patients, making a larger enterprise. Success to me now is growing workshop strategy,
Mhm.
but also being a good father and a good husband. I don't think I knew what true love was until I had kids.
Wow.
Yeah. I want to be there for my children in ways my parents could not be there for me.
Yes. That's very important actually.
Yeah.
Spending time with kids is something which all of us have felt because our parents were, from a background where they needed to work,
Correct.
take care of the large families and things like that. And we were not fortunate enough that we are today,
Yeah.
who are willing to spend more time with our children in their upbringing.
So the way I look at it is, what is the point of success monetarily if you're just going to go to the next thing and make more monetary success if you're not spending it with children that you brought into this world?
Yes.
So to me, honestly, this sounds a little, I don't know what it sounds like, but when I go to put my daughter to bed at night and she's crying because she wants me back, and I just hold her in my arms at bedtime, and she, I can give her a sense of security that nobody in the world can give her because only I'm her father.
Absolutely. Yes.
That's pure happiness and success.
Wow. Wow. Okay, Sam, your foundation has made a major commitment to healthcare and education, including blindness prevention in India. Why only blindness? Why this mission? What does a world without preventable childhood blindness looks like to you? Just because you had an experience?
Look, I think children, infants, toddlers, they're the most innocent part of society.
Yes.
They didn't choose to come here. They didn't choose to be here. And they sure did not choose to be born blind.
Absolutely.
So if we can prevent that blindness, or in my case, cure it, you've unlocked society. You've unlocked that human potential for the next 80 years of life.
True.
I am the product of the I Foundation's charitable work. The least that I can do is help others who are in my place.
Wonderful.
That is
Absolutely
the
wonderful.
least I could do.
Today, with the technology, and you see, I was interviewing another gentleman who's taking care of children who are born with heart ailments.
Mm.
There was a story that he narrated to me that a 7-month-old child had only a couple of months to live unless some, corrective measures could be taken. And our Rotary has got an arrangement with Safdarjung Hospital. And within a month, one telephone call saved that child's life.
Mm-hmm.
They did open heart surgery onto the child.
Amazing.
It's absolutely amazing. And same thing, you are a living example.
Yeah.
You can see, and today one intervention by doctors sort of motivated, treated you, and you changed not only your life, you are changing lives of all those people who are born with this ailment. That's so amazing.
I think the credit goes to the I Foundation and the creator of that, just Dr. Raju.
Dr. Raju, yes.
He, championed philanthropy, giving back, which I became a product of. I also want to give a little bit of credit to my father, because Dr. Raju, we talk about this often, where he's treated, thousands of patients in his lifetime. And patients come to him, he treats them, the foundation treats them, and then they go on with their life. My father was very pivotal in not just getting the treatment, but also going to the events, the charitable events, taking me to those events, showing me how we could help others. And children are a product of their parents' lived experience. And because Dr. Raju gave me the charitable piece and my dad reinforced it, that's, I think, what really allowed me to experience and give back.
Wow. That means you were born true Rotarian. Wow. And how important are the collaborations between NGOs, healthcare providers, and the government? Because you have dealt with all of them.
Yeah. I think at the end of the day, we cannot solve every problem.
Mhm.
Capital is always limited. So, and the government is not the solution to all of our ailments. So we do need NGOs, we do need physicians, we need ordinary human beings to look within and give a little bit. So I think the idea that NGOs work in collaboration with physicians and with government is absolutely essential, because you need the NGOs for the funding and the resources, but you need the government for the underlying structure to help people.
Absolutely. Now, there is another example. A lot of people feel that, it's very difficult to do liaison work with the government or take their help. When I was a president many years ago, in 2019-20 of my club, we started a skill development center, and we did it in collaboration with Delhi government.
Mm-hmm.
They gave us a place free of cost, which is the most expensive part of any project in Pusa Institute. And we opened that skill development center. Since then, it's been running. We have trained thousands and thousands of children, with thanks to the government of Delhi and government of India for sort of supporting causes like this. Because when you educate one person, you are changing 4 lives.
100. I agree. And you're fortunate to have the support of the local and the state and the federal government.
Absolutely. You work at the intersection of mental health, pharmacy, and strategy. What do you think healthcare is headed in the next decade?
I think healthcare, I travel a lot for work, for nonprofit, and I think healthcare is headed in different directions in different countries. So if you look at, quote unquote emerging market like India, folks have now health insurance. So the poor, who are now becoming a little bit more middle class, have now health insurance.
Oh, yes.
So therefore, I think healthcare is, in India, healthcare is bringing more access to people who could have died or, other negative ailments. In places like the US, healthcare, we can say, is overburdened. And over there, we're heading toward a place of very personalized medication.
Oh, okay.
So what that means is we are going away from systemic health insurance-based healthcare to a place of fee-for-service. Like, I want this specific doctor that will only see me and maybe a couple of other people, and I'm willing to pay for that premium because the healthcare marketplace has kind of broken down and is unable to treat people to the same level that they used to be able to.
Oh, okay. That is the present system in the US, is it?
It is. I do feel that it's kind of not working the way it should.
What do we still misunderstand about mental health? There is a lot of gray areas, a lot of confusion. Let's talk about that.
I think the biggest misconception about mental health is that only you're dealing with it and nobody else is. The real truth is, as human beings, we all have issues. We all have extreme lows, extreme highs, and I'm sure some of us are struggling with undiagnosed conditions. So I think mental health is a disease that cannot be seen, but can be felt and can also hurt. So at the end of the day, it is, the biggest misunderstanding is that you can get over it. You can will your way out of a situation.
Mm-hmm.
And it is not true. you do need intervention medically at some point if your disease is just as bad.
That means one has to realize the fact that yes, there is a problem. And once you realize there is a problem, and if you are willing to get better, then as you are saying, the medical intervention is very, very important.
Yes, with the caveat that it's not just them, they might be in it pretty bad, that their family has to realize.
Family has to be.
So, if somebody was, let's just say, has a fever that's getting really bad, this is not mental health, just regular health care. They might not know how sick they are. The family has to see that. And the family has to say, this is pretty bad, we need to go to the hospital.
Right.
So it's mental health is also a community-based, family-based issue. It is not a singular person issue. So the more we normalize mental health, the more we talk about it, the more we are open about it, the more we can help it and fix it.
Wow. Now, which innovations are overhyped and which are under-discussed, especially with regard to mental health?
Mm-hmm. Again, I think healthcare changes by country. I can speak about the American medical system. And in the American medical system, with regards to mental health, I think we overprescribe medications. As a pharmacist, I would tell you that. I do think India does a better job about prescription of medication. I think in America, whether it's be ADD or ADHD or a few other conditions, we overprescribe. So medication should be used as a knife in a certain parts, but a lot of times therapy, talk therapy, could be used.
My brother is practicing cardiology in the US.
Mm-hmm.
He's a very famous doctor in the entire tri-state area. And he was telling me, he says, listen, I've been doing practice for the last 40, 45 years. The moment I have a patient, I see his pulse, I take his BP, I talk to him. I know exactly what is wrong with him. But he says, I have to prescribe certain tests which are mandated by the insurance companies. He says, at times I know that this set of medication is going to be fine, but I have to add 3 more so that the insurance company do not bother me later on if by chance something happens.
Yeah. Well, America is...
As you said, oversubscribe the medication.
I mean, look, I think him and I speak the same language.
Yes.
America is a very litigious society. So physicians have to play defense. They have to do a whole bunch of things to make sure they don't get sued.
True.
So I think that's the problem. I think that's why healthcare is a little bit broken there.
Yeah. Now let's go back to your other aspect. You now advise private equity, Fortune 500 companies, and healthcare startups. What makes great healthcare organization?
At the end of the day, anything to be successful needs 2 things. A really good idea and a extremely hardworking, passionate individual. You can have a great idea, but if you want to work 40 hours a week, it's not going to work.
It's not going to work, yes.
You have to give it your all, and it has to make sense, right? There has to be a need, like you mentioned, the gap.
Yeah.
Where is the gap that this person is trying to fix?
Like what they say is need assessment is more important before starting a project.
Exactly.
And then obviously the commitment to fulfill...
To see it through.
To see it through, absolutely. What role the AI, digital health and behavioral health play in shaping up the future healthcare system?
I think anyone that gives you a clear, straight answer doesn't know. So I think at the end of the day, technology, AI, can play a role in healthcare. For example, if you're reading an MRI, if you're reading an X-ray, you're reading an ultrasound, the AI tech could probably read it pretty well based on, the data that it's been collecting over time, and maybe enhance the physician's ability to see something that the physician didn't see. So that's where I do think AI does a great job, right?
Okay.
It might be able to find cancer in a breast cancer imaging that maybe a physician didn't catch, or tell the physician where to look more. As an anecdote, I recently went to a dentist. And when you go to a dentist, they take an x-ray. Before the dentist came in the room, the AI overlaid that and showed the dentist where there might be possible cavities. So the dentist can check over there. Again, it wasn't that the AI said, hey, this is a cavity. It basically said, check over here. It's kind of like directional. The other side of AI, which I do think needs to be talked about, is you can't AI your way into medicine, because at the end of the day, medicine is a physical thing.
And depends on an individual to individual.
It's an individualized medicine, right?
Yes.
You have a patient, physical. You have a physician, physical. You have a diagnosis or diagnostic system that's physical.
Situation?
Yeah.
Also has to be totally
assessed.
different. Yeah.
So there is no one size fits all. Also, AI works off generative data over past data, but you're a brand new case. And there's only so much previous data that'll fit to you.
So AI is going to be aiding the doctors and patients and the people who are in this business to basically add value and save time.
Yeah. I also think, look, it might replace jobs. I think that's something that needs to be talked about.
Yeah.
Maybe for another podcast. But I think it will replace some jobs, but I think it'll add other jobs, like all technologies.
Yes, absolutely. Now, you mentor a lot of young pharmacists and entrepreneurs. What advice would you like to give to them?
I work with entrepreneurs on a daily basis. I was on a call with them right before we got here. The biggest advice that I can give anyone is, if you're gonna take the leap to work for yourself, you have to be willing to risk everything. If you're not willing to risk, don't do it. For example, if you want to start a company, before going to the bank, ask your parents for money.
Yeah.
Ask your family for money, because they will hold you to a higher standard than a bank.
Yeah.
And if you're not willing to put your money where your mouth is and take that risk, you're probably not going to succeed, because it's extremely difficult.
Wow. Now, which matters more today? Technical knowledge, empathy, leadership, or courage?
I think a little bit of both, but I think in business, especially, the top two layers are going to be courage. Like I just said, you have to be willing to take the risk. And real leadership. Real leadership doesn't mean, I have these employees, I'm telling you what to do. Real leadership is getting people engaged to work the way you need them and the way the company needs them, to understand what the needs of your employees are so that they can work for you in the best way possible.
Obviously, if you take care of them, they're going to take care of you. I mean,
Right.
As simple as that.
But different employees have different needs.
Yes. Now, at TrueRotarian Podcast, we believe that service above self can transform communities and life. What does service above self mean to you?
It means to be compassionate. It means to be not thinking about yourself and thinking about the other person who could benefit from something that you have. Because it is not a zero-sum game. It doesn't mean that if I help you, I lose. If I give you $1 for surgery, it doesn't mean I have $1 less. I can help and also be okay and be successful.
Wow. If you were to describe the joy of giving in one sentence, what would that be?
It's very simple. I feel that I mentioned to you earlier, when I held my daughter at night in my arms, and I can give her the safety and comfort to feel so safe and comfortable that she can go to bed at night, that is the exact same joy I feel when I give back to the I Foundation.
Wow. Now, thank you so much, Sam, for your insight and your spirit of service. Your journey reminds us that when we receive a gift, the most powerful response is give it back.
Great.
From all of us at TrueRotarian Podcast, we are indeed grateful to you that you have taken out some time here in London to come on my podcast. And to all my viewers, if you like our podcast today, please do like, share, and subscribe. And if you also have a story to tell or a project to discuss, please get in touch with us. It'll be my honor, pleasure to talk to you. Thank you so much, and Jai Hind. Thank you, Sam. Thank you so much.